Very good evening and thanks to everyone for joining us today. I, Ankit Dogra, along with my teammate Mr. Amit Saxena from Medical Services Jagsonpal Pharma Ltd, welcome you all to the episode 2 of the series Pearls of Wisdom, Key Opinion Leaders, organized by the Society of Meaningful Life Management with academic partner Jagsonpal Pharma Ltd, makers of Divatrone, 10 mg tablets of micronized dydrogesterone, indigenous and affordable for a safer and smoother journey to the motherhood. We also present Injection Maintane, 500 and 250 mg depot 17 alpha hydroxyprogesterone caproate to maintain normal pregnancy till the term, and LycoRed Preg sachets of L-arginine, Lycopene and DHA for high-risk pregnancies. We extend a warm and hearty welcome to all the esteemed speakers, experts, and attendees. Dear attendees, we request to post your thoughts and opinions by the text in the Q&A box. Please note this webinar is streaming live on the Facebook and the link has been shared in the chat box. To refer to this webinar in future, please visit our YouTube channel, Jagsonpal Medical Insights, as the complete recording will be uploaded there. Now, we would request Dr. Maninder Ahuja ma'am, the progressive, thought-provoking leader, creator of processes of going digital, online voting, e-newsletters, online journals, and the founder president of SMLM, past president IMS, FOGS, vice president SAFORMS, to kindly initiate the proceedings. Over to you, ma'am.
Thank you, Jagsonpal and Mr. Ankit Dogra for kind introduction.
Thank you,
now, it's a proud privilege to welcome Dr. Hema Divakar to this series of Pearls of Wisdom from Key Opinion Leaders. Now, these key opinion leaders are pillars of the women's strength in our country, and they have been working constantly with the passion for the women's health for so many years. Perhaps many of you had not even joined these professional organizations at that time. So it's my honor to give my, please show her CV, Dr. Hema Divakar here, who is very, very close to my heart, because she is vivacious, childlike enthusiasm, and she is so effective with her enthusiasm that you would love to be part of her various programs, which is she's doing now. She's medical director of Divakars Specialty Hospitals and CEO of and chairman of Artist. Artist is her idea, her brainchild. She's Dean KCOG, past president of FOGSI 2013, vice chair for FIGO PNCD committee 2015 till date, and she has been elected as chair of Well Women Healthcare at FIGO, an advocate for delivering quality healthcare, convener of Manthan, an opinion leader, and an influence for social and legal issues. She has received many awards and recognitions: Global Asian Award, FIGO Women Achievers Award, CME Excellence Award for Artists, CSR Times Award. So, Hema, you deserve much more than the awards, because awards come and go. But what the love we have for you, what the respect for you, what you have earned from you as being a real enthusiastic leader who is thought-provoking, innovative, and changes her thought processes and working according to the time. Welcome to this webinar series, where we are doing now the Pearls of Wisdom from key opinion leaders from our profession, and how we are going to transform women's healthcare by going digital is the hottest topic which can discuss in these times, where the COVID has taught us to go digital also. So Hema, it's all to you, and we'll be keeping up to the time.
Thank you so much, Maninder. We constantly keep inspiring each other, and I'm in the best of the companies today with Maninder and Girija around me. That is an enabling environment for the discussion that we are now going to pursue. And the Lage Raho principle, never give up, challenge the constant, see whether whatever we are doing can be done differently. That represents none other than Maninder Ahuja, because she is the one who sowed the seeds of digitalization, into an organization and against much opposition. Okay, she stood her grounds and she said, this is the way to go. Many of us in our own little circles with our own gadgets, we used to explore the digital platform to whatever we thought was the maximum. But to get the whole cream and teams into the mindset of go digital, congratulations for pursuing your efforts relentlessly. And that's what made my choice of topic very, very easy today. Because if it is Maninder's program, I cannot speak anything about wisdom unless we have the mindset of being flexible, being in sync with the virtual world. And it's so delightful that Jagsonpal, Amit and Ankit have brought us together in this connect, not only with my very beloved leaders, whom you see on the screen, but also the very lovely audience who may be watching this show now or even later. That's the luxury that the digital platform gives you. So the Asian Research and Training Institute for Skill Transfer was basically because of the idea that the gap between knowing and doing should be bridged. That is where the skill lies. Because I often give the example of many of us who have traveled right across the globe in the aeroplanes, and every time we don't pay much attention to what the hostess is saying by way of the mask dropping and do this and that. When actually a crisis happens, I'm sure that 80% sitting on the flight there, how many ever times they're exposed to it, unless they've done it once, they will not get it right. So that is the key for the skill transfer. And could it be done digitally? That was the challenge, that even before the COVID era, our flagship initiative of a parent professional organization, FOGSI, threw at us. We wanted to skill many, many frontline healthcare providers. And how can all our leaders who are ever so busy reach the last mile? When that thought process came, it was yet again a beginning of the new era, where just like Maninder, Girija and others, I was determined, why can't skill transfer happen through the digital forum and transforming the future of women's healthcare through digital skill transfer? Well, the proof of the pudding is in its eating. We said, get the batches on board, let's skill them, let them get assessed, and their performance in the assessment will be the answer to the fact objectively, whether it's just an idea and a fantasy from our heads or whether it's the reality. And lo and behold, we were so delighted that we could touch right from Kashmir to Kanyakumari, if I must say, right in the interior of Jorat, Imphal, Manipur, all those areas, and the northern parts of interiors of Karnataka, small villages where they came on board saying that, we can't match the metros, but believe me, the insights we got into their sincere commitment to doing their best for women's healthcare keeps us more and more inspired to continue this effort. So how can we train 1 million healthcare providers? And why do we need 1 million? At least we will need 1 million to take care of 30 million deliveries every year in the country. At the moment, the skilled workers have a dismal number existing, and everybody with just 2 hands and legs are moving around in various settings without any background skills, or they have some kind of a knowledge, but when they're actually asked to do certain simple, key, important things, they have drastically improved in their performance after the skill transfer. So this is one of the major vision and missions of our life, so to say, because the supply side, the capacity building, the training, the skills that they learn, lasting with them forever and forever, can do the best for the girls and women of this country through every nook and corner, breaking the barriers of the geography, and India is already creating a history by leapfrogging. So what inspired us? This was, of course, a passion, but it has now turned into a purpose, the underlying hunger for a social change, because the gender divide and inequality in our country, the women today can hook on to a digital platform and speak to her doctor. But if she had to actually visit the doctor, maybe she doesn't have the access on her own, or it's probably the family considers it's not safe for her to travel on her own, and the husband or somebody else in the family should come along and go and take her to the center. Now she's no longer dependent on that because she has the digital connect. So this kind of a gender inequality also, we see an opportunity to build it by the digital platform, especially in the women's health sector in low middle income countries. And the big vision was, if you do a little bit, just 10,000 out of that 1 million, really it's a drop in the ocean. We will not be able to achieve an impact. So to scale this to the maximum, that was the key where the digital platform helped us. Maninder, can you see the slides?
Yes, of course, and we can hear you very well.
Excellent. So we were working on this ABCD initiative for 2 decades now. We said A is for anemia and adolescent care, B is to build the contraceptive choices, C is cancer cervix, kill it before it kills you, D, diabetes and pregnancy, E is the essential obstetric care, but E also stands for etc. because we have many, many things to tackle. So to redesign the pre-pregnancy care, to redesign the adolescent care, to challenge the very care of pregnancy that is happening so suboptimally in our own country and in our neighborhood as well. How can we innovate? How can we digitally transform the maternity care? Both pre-pregnancy, the large chunk of red I have shown is the pregnancy, because that's where women will actually seek help, because pre-pregnancy, as Dr. Girija was just saying, that they'll say we'll cross the bridge when it comes, so they're not even bothered till actually the crisis strikes them. But I think the COVID has changed the mindset pretty much for preventive healthcare. So pre-pregnancy care, care in pregnancy, post-delivery, beyond for her rest of her lifetime. Can we do more? Can we do better? Can we go digital? So the adolescent care, yes, we need to pay attention. We are showcasing that every 1 out of 3 pregnant women is anemic, and 20% of them die because of anemia. Could not we have built her hemoglobin before she embarks into a pregnancy? Half of our girls being anemic. What can we do? Can we use the social media? Can we incite and excite them to check their own hemoglobin? Can we give some dietary advice and build awareness and advocacy? Can we do the teaching and training programs for anemia care and nutrition care through the digital media? Well, the opportunities lie in plenty. When we say plenty, there are still many in our country who say, oh, you're from a metro and you think that you can use the digital media everywhere. But India has leapfrogged in the true sense. They may have just about got into the clean drinking water and the toilets in their own homes, but mobile, they would have had it for a couple of years, even before all the other essentials happened. So the numbers which are using the mobile technology, when we say your health is in your hands, it truly means now that the health is in their hands, because more than 1,130 million subscriptions from our own country, which again makes us realize that if we can exploit and explore the digital media, certainly there is no doubt that we will transform the healthcare. The femtech space, the technology and female healthcare, large number of them are, as you can see, working in the pregnancy space. That is the largest bar. And then the fertility and longevity and all of these things, the competing new innovations are in the market now. So to test, treat, and talk, when we say this, even talking is through the digital media, because if we can go from one school to another and address about 500 girls, we will never complete the 300 million that we have to cover. So the mass scale, to scale is the power of technology. And you can very well see in this picture how India is changing. And do not be under the impression that these young children, these young women, no matter whether they are living in a tiny village, they have the access to the mobile. They're wise enough. If we sensitize them, they will use it for the correct preventive precautions that they may need to take. And if this mother is empowered with the correct knowledge about what she needs to do to take care of the children around her, it'll be again a great. And then we have many within our own circles who are passionate and who are very vocal and communicative. So the kind of Facebook live streaming which we can do to reach all of these so that in their own languages, we have never found internet connectivity to be a barrier, but certainly I must confess that we have found the language to be a barrier. As I speak today, the national education policy has changed, and I believe till standard 5, the children will be taught in their own mother tongue, with English as just one of the subjects. Many times when we address the staff nurses, we can very well figure out that if the skill transfer sessions are only in English, they draw a blank. But when you speak to them in Hindi, Tamil, Kannada, and Assamese even, we have our Assamese doctors like Arun Barua who will sit with us in the class and we will talk in Hindi, but small nuances, he will help them understand in their own language. And that is really crucial. The non-invasive devices, the digital devices which have come, you need not have a skilled healthcare providers to check this. We have found on the COVID era that anybody from interior of West Bengal, a patient rings me up, she's from Purulia or some place which I have not even heard of. She says, pulse oximeter hai na? So I've done, and this is much as my oxygen saturation. I said, wow, I don't even have to spell out what it is. She's telling it with so much ease. So the kind of equipment which are now available, which we call a point of care equipment, they need not come to the hospital, or the ASHA workers need not go home to home. This non-invasive testing, you can do it just about anywhere and everywhere, whether it's in the bus stands or the railway stations, or we have all experienced that now the temperature check is done at every entry point in any public place. The same way a non-invasive device, the hemoglobin, and then you sensitize them, testing you have done, you have to back it up with a pop-up message about how serious this is and how they have to take care of themselves, and talk to them about it through the digital media. It will really drive India towards what we call the anemia-free India or anemia mukta Bharat. That dream should become a reality by exploring the digital. That's what we call transforming the healthcare, because anemia, we've been talking about it with the policies in place right from 1972, but 4 decades gone, and we are now escalating our voices. So this is one new innovative point of care device. So also the digital BP device and the weighing machine, many will know how to use it, what is there, etc. So the point of care thyroid testing devices are also now in the market and have been validated and got their certification. It is very sad to see that the salt is iodized, but 30% of Indian women and the families do not use iodized salt. And thyroid testing with a lab testing in remote places is not possible. So if they are missed out, the very preventable mental retardation in the generation next, which really, it's a simple thing to do if we use the point of care device for thyroid as well. So some of these simple things that we need to actually do to take us a step closer to the anemia mukta Bharat. All of these Anganwadi workers whom I'm interacting with, they were super thrilled that they recognize that not a single child in their village, not a single girl, not a single woman they have spared. They have reached out to all the 5,462 of this population and seen to it that the hemoglobin is tested, they're given the due dietary advice, and they've given the samples of medication, followed it up, made sure, and they are all saying that, madam, by the time you come next, we will see to it that ours will be declared as a wellness village, and we will go many, many steps further for becoming anemia mukt. And you see the staff there, whether it's Anganwadi or Ashas or ANMs or the staffs in the nursing homes, they are happily sitting either hooked onto their mobile or the laptop and getting the T3 module for anemia discussed, and they have to make notes and see an X number of patients and report back to us, because we know the status of anemia. No use just documenting it and keeping. We need to walk the talk. We need to go to the next step of treatment and talking, so that the rest of the family is also covered with that. This is a new era problem. This is what we were just discussing before the program started. Obesity today is the forerunner of so many health risks tomorrow. We will not get a handle on this if we don't act upon it now. And the World Obesity Foundation has also declared that India, where they considered malnourishment as a major problem, has taken a total swing, 37%, whether rural, urban. Let's not be confused about the perceptions. It is real that obesity is on the rise, and our verbal advice is not taken seriously, and we are overwhelmed with the volumes and number of patients. So we say, okay, now we can't do better than this, and we are not even having a strong capacity to mix and match the multiple dietary cuisines in the country. If you come to south of India and you talk to her about something that she never eats, and you counsel her regarding this is what you should eat, not eat, she cannot relate to it, because her diet pattern is completely different. And all of this is so very important, because undernutrition as a cause of millions of deaths, overnutrition as a forerunner for non-communicable diseases, diabetes, hypertension, micronutrient deficiencies. With an inadequate diet, the WHO has now come up with the triple burden, which needs to be very seriously addressed. So the target, the large red circle that I had drawn, the pregnant women, they harbor or program the in utero programming, as we call it. The next generation is programmed to multiply the anemias, the diabetes, the cardiovascular diseases, the cancers, and everything that happens, which is all beginning in utero. So this is a very good window of opportunity for us to target, but there are challenges. But there are equally a large number of digital innovations in the maternal and newborn health. And we have to drive not only the community to adopt it, but we as healthcare professionals also have to change our mindset. Because there are many who don't believe that digital can do a lot. But they say, no, touch and feel. But when she comes, only we can touch her. When she can't come, then what will she do? It's all a non-phenomenon. So the hybrid kind of models which we are having in the webinars and the CME programs, for example, moving ahead, really, it needs a serious thought. The 10 times she need not come to the hospital. 6 out of the 10 times we really can handle her through the video consult or the point of care and the Bluetooth device which sends us the reports. But the trust factor on the digital platforms, both for the peer group and the people in general, I think the new era girls and the boys as well, it's just a question of another 5 to 10 years. They will all be hooked onto this, and we will be nowhere if we do not match and adopt ourselves to these challenges. So what can we do? Is it so overwhelming to hop onto the digital platform? At least people on this forum would say, no, it is really so easy, because we leverage on the existing platforms. It really requires very rudimentary tech and interoperability from one system to another, some on the mobile, some on the laptop. The devices are also becoming really affordable, and the variety of social media, the Facebook, the Twitters, the LinkedIn, somewhere it sparks off. Somewhere it starts their thought process and they will come and seek help. And I feel that things like HPV vaccines, the demand has been growing in the recent past because of the communication through the digital platforms. So coming back to the pregnancy care, we have been struggling for long to convince all the OBGYNs to test all the pregnant women at least twice in their pregnancy. So that's why I've put the blood sugar in the center, because many, many hyperglycemic cases are still missed. Out of 100 women that we have to test when they are pregnant, the NFHS data shows that only 28 out of 100 are being tested. So the new devices like the WISME or Where to Be, WEAR to be, that's a wearable device. Many of you would have seen it. It's just like an activity tracker. It's just a band that they have to wear. So any semi-skilled person can go and put the band, take the blood sugar and convey it to the consultant, wherever the consultant may be. And if it is in the red zone, then further advice and action can be taken. Lots of language-based information, where we always grumble that we don't have time to talk to the patient because of the constraint of the emergency cases. That as we started the program today, Maninder had to run and attend an emergency and come back again to be with us. So really, there is a time constraint. So if some things can go automatic and seamlessly through the digital platform, why can't it transform? We agree that the look and feel and touch should be there. Yes, wherever possible, it can be, but just because it cannot happen all the time, we should not deny our girls and women the minimal care, non-negotiable care that they should need and they deserve. So pregnancy education, advice about nutrition, digital BP measure, hemoglobin, thyroid, anybody can do it at their doorstep, or they can do it themselves, like the pregnancy test, which most of our women now do it, like the point of care device, and then the sugar charts and even the monitoring of the sugars when they're high, they just seamlessly get connected through the digital devices, and the whole charts are lying in front of us to guide them for what next they have to do. So the new devices, which we are collaborating with Israeli authorities, because Israel is a place for innovation. It is a very, very fertile ground for innovation. So we are going to be bringing in for prediction and prevention, which is Girija's main passion area for the preeclamptic toxemia and the preterm labor. If we can predict it, if we can predict the onset of hyperglycemia or GDM, if we know that the placental circuit is denying the baby for its optimal growth, and is there any chance for an impending IUFT? All of these are by simple non-invasive devices. It can be tracked and predicted. The algorithms with the AI are coming in. It's quite easy to use. And now with the digital platform, we are convinced that to give the small PHC and subcenter this device and train them on how to use it, they don't have to apply their brains. They have to just quietly use this device, and then we get all the information, and then we can act upon it to do a lot more better. So the training is the key. And then out of 100 patients, maybe only 12 of them need the teleconsult. That is how we declutter our the volumes, that everybody need not come to the highest order specialist because they don't need to, and we will not have the time to address the 30 million. So the 10-week NIPT, which can be done by other new technologies, the triaging, the home OGTT care, the ovulation kits, which are, you know, of a better quality and better interpretation, the pregnancy package itself, there's a whole transformation that we can do. And the learning management system, now we are doing the training in a very naive and a raw way, just like connecting with the Zoom and doing. But seamlessly, if it has to scale, then a proper learning management system. If our peer group believes in this, believe me, it will be a very strong step forward, because seamlessly there are about 60 to 70% of the things that can be automated. We need not go and tell the same lecture, same thing again and again and again. They can be automated, animations can be there, gamification can be there, the video clips can be there. It will be edutainment, and definitely the skill transfer will go to a very high level of care. Government is, of course, planning a midwifery program with 300 midwives for the whole year. Not enough. Just not enough. By the time they finish their 18 months, I think in 18 weeks, maybe in 18 days, we can train many, many more. So that is the vision. And we always resonate with each other, Maninder, Girija, and myself, that if it is important to you, you will find a way. If not, you will find an excuse. That is the wise pearl that I want to place. So to connect and collaborate, get many partners together. And when we say add years to life, or the cliche terminology, add life to the years that we live, Maninder has introduced a very meaningful word saying add meaning to your life. That is really the key. And if you want to do something meaningful, then you need to reach the care to the last mile. So the diagnostic management and follow-up with all these interconnected devices, either use it in small primary healthcare setups within your own setup. They don't need to come to you. You create a station, like how Girija has created a dip station. They are all sieved and taken care of there, and then they seamlessly flow into the top-end specialist who will just need to do that bit where it requires the step-up care. This fetal heart monitor, see how tiny it is. It just looks like this is called Vidyapeeth, but now Atmanirbhar. I saw that Atmanirbhar word and Make in India pride with Jagsonpal as well in one of their slides with the Dydrogesterone that they're producing. So similarly, there is a FitoSense, which is a similar device. And so what we did was, then this device is very handy. It has no wires hanging anywhere. It will give you an NST graph. Anywhere on the abdomen you place it and just switch on the button, and through the Bluetooth the entire graph comes, and the consultants can interpret it seamlessly. In the COVID times, we bought 6 of these, and our high-risk patients who had less movements, GDM, hypertensive, who had to come back and forth, maybe even sometimes at the frequency of twice weekly, we said COVID times, no, you take this device, use it yourself, send us the strip. And hundreds of them have used it by now. We rent it out to them in the last 4 weeks of pregnancy. When they deliver, when they're admitted for delivery, they give it back to us. It's in itself, it's a good business model, because there's one device can be used by so many, and it is very, very easy to use right across. Even the Anadi patients who we call, they are very savvy with their mobile devices. They know what an app is. They know how to download. They are better than many of our senior peers. So this is what we've been doing in the recent past. And 10 of our Manyata centers, as a pilot, we have given this device to them. And believe me, we had set up 1 hour as a training on this device. And we said, you keep 2 patients with you, keep 4 staff nurses, and just let the junior doctor be. The head of the institute need not come and stand there, because NST is done by, the frontline healthcare providers. The whole training got over in 15 minutes flat, because it was so easy for them to pick up. And we were amazed, because I said, what am I experimenting with in an interior of Tumkur, and Athani is at a small village, and then in some part of Ratlam, I'm trying to do this. Is it possible? Is it not? But I said, there's no harm in trying. And as on today, they're sending us all the data. And one day, just one day in one center, there was some technical problem with the device. They had got so addicted to it, they're feeling like fish out of water, that they wanted it corrected as early as possible. So we need to move from awareness to action. We need to build the capability. And as I have always said, the digital health solution is going to run the front line rather than a new type of insulin or a new drug which comes for management of hyperglycemia. So the digital device actually for the diabetes care in pregnancy, for example, the dietitians advise that they have to get on the videos, the pop-up on whether they're eating right or not, the glycemic index of various foodstuff. A lot can be done. Please, please never underestimate our women across any zone in the country. They're all very wise. So that is again another pearl of wisdom. Give them an opportunity to do the best for themselves. The time is here and now. The technology is indeed transforming women's healthcare. The future, as we could see, is very, very bright. We plan our campaigns, create the awareness, get them and encourage them for action, and sustain the movement. It will really go a long way for the next generation. There are multiple things involved in this for a continuum of care. We need many partnerships and collaborations, but the key is to connect. Multi-skilling, use of point-of-care diagnostics, community mobilization, awareness building. Even the government has started one more e-financing. They just send them a QR code. So they have to, it's a part of the Anemia Mukta Bharat scheme. So they have to just go to the PHC and show that QR code. That means they're eligible for the anemia test without any payment. The kind of public-private partnership they have drawn. A PHC attached to a private partner, but as many QR codes as she screens, she will get the finances from the government. So they're trying to work out of, in an out of the box kind of a thinking, and the implementation, both for advocacy, the training, the research, connecting the dots, squares, hexagon, triangles, everything. That's what is the need of the hour. And now I'm quite excited that the ABCDE, which we started 2 decades ago, is at the brink of really making an impact, because the scale has tremendously increased in the last 2 years. Thanks to the digital connect, everywhere and anywhere. We were running only 1 batch per day in 1 language. Now we're running 3 batches per day, and the impact is escalating. And though after the COVID time, we said we'll minimize the video consultations, but it is quite the reverse. The video consultations are, as of now, choke-a-blocked, with Indians staying in Luxembourg, in Germany, in Dubai, connecting with us because they feel the kind of language that we speak and the connect that we give, and the reassurance is much more for them. So everybody, just about everybody, has a role to play, and access should never become an issue on the digital platform. SDG 3 goal, taking over as a chair of the Well Women Healthcare in FIGO, good health and well-being for all. So the digital connect, the digital gadgets, and above all, the attitude that this will work. So even before the show closes, in an advanced way, here we go. Maninder, the pride of accepting something so lovingly from, with the lovely plaque sent lovingly. It says Society of Meaningful Life Management honors Hema Divakar, Pearls of Wisdom series, and it acknowledges my contribution, a small contribution to women's health, but the scale up and the inspiration that I have derived from just about every champion and everybody around me is the key. And innovative, thought-provoking leadership is shared vision between all of us here. So I really, really appreciate, Maninder, that you've put up this series of the program, and it's been a sheer delight participating in this event. Namaskar.
Thank you, Hema, for being here. But now comes the real role of Dr. Girija Wagh. Please, I could not introduce you early because of that emergency. Please show her slide of CV, because she is the now who is going to do the Manthan of what Dr. Hema Divakar has said. So this series are our small lecture series by key opinion leaders and the other experts coming and discussing how we can move ahead from this point where we have reached, or what innovations we can do still further, how we can walk faster together than walking alone. So my honor, Dr. Girija Wagh, to welcome you here. We met years and years back in FOGSI itself. I never forget the day. I never forget the journey. And for you and for me, both together, it has been working hard together in the FOGSI and the other organization. She is Professor, Department of OBGYN, Bharathi Vidyapeeth Medical College, Hospital, Pune, and Senior Consultant, Cloud9 and Apollo Hospitals, Pune, Faculty Professor, Wagh International Experts, General Coordinator, 2016, Chairman, Medical Disorders in Pregnancy Committee, FOGSI, 2012-16, Vice President, India Chapter of Justosis, Member, Governing Council, ICOG, Joint National Secretary, FOGSI, Assistant Coordinator, National Eclampsia Registry, and Member, Central Supervisory Board of the PCPNDT Act, National Mentor, Laksha, and Peer Reviewer, Jogi, VJOG, EGOG, all journals, and Course Director, Study OBG, and Anand Bhai Joshi Award for Excellence in Medical Services. If we talk like CV like this, it doesn't mean anything. But I have to describe you, Girija Wagh, because I have followed her. Girija, perhaps you didn't know, but I was following you your webinar. So she is the one who actually took advantage of going digital. So like Hema Divakar has said, to reach out to the last miles and empowering women, the new word, technology word is now digitalization. So women empowerment education is through digitalization. I'll give my comments later on because Girija Wagh, now give you your expert comments how the women healthcare is going to be revolutionized with the digitalization. Actually, Dr. Hema Divakar had given me two topics. One was the women healthcare revolution and second was with digitalization. I said, no, digitalization is something we need. So this is the way we had to move ahead together. That is very important. Collaboration, and collaboration. I hope all the organizations understand that by collaborating, nobody is diluting their identity. Their identity remains there, but then we will be doing much better for the women's health if we collaborate. Dr. Girija Wagh, please, your expert comments. And I always appreciate the way you talk and you analyze things, at least scientific data. So this is also a science because we can reach out to A, B, C, D, E also now with digitalization. Yes, Girija.
Absolutely. So at the outset, I would like to thank Dr. Maninder Ahuja especially for calling me here. And her innovations are wonderful. And what a name, Society of Meaningful Life and Management. And it's so very important. And while you were reading the CV of Dr. Hema Divakar, you just made the abbreviation of the PNCD. But I must tell this August gathering that NCD means non-communicable diseases. And this is what Dr. Hema is looking at a global level. And while we were working in FOGSI, trying to think of anemia, PPH, constantly her endeavor went on to speak about anemia. She brought in an introduction and awareness of diabetes, transgenerational approach towards it, obesity, and now who else but Hema can bring us the digital revolution, putting it into an all perspective. Now, since you asked me to make a scientific comment, and before I go on further, I must thank the Jagsonpal group for giving us this platform, because it's extremely important and we must thank them because this is a digital medium which has made it possible. And then only we could connect, in which parts of the country we three are sitting and where Ankit Dogra is sitting, I don't know. So all of us are connected digitally and we don't feel the distance. We have traveled the journey, which probably we used to say sometimes in Pune, we used to very constantly say, Bombay is 10 years ahead of us in all evolution. But today, with the COVID and the realization of digitalization, we feel all of us are there together. And what is more important, Dr. Hema brought in a very, very important aspect, and which is something that I also did not realize. One was we collected surveys, that was one thing. Then we got academics reaching out to the corner and nukka of FOGSI through all the webinars and everything that we did. But she brought about training. Training, okay, fine. Training of the healthcare providers. But connecting to them for the needs and connecting this entire thing to the patients is something that is extremely important. So today, while we are moving around from this particular aspect of talking about person to person, we are seeing that one part of the digitalization has been taken over by consultations. There are a lot of such media platforms which are giving us facility of consulting to our patients while on the go. For me, it started before COVID started. I started doing this consultation through various apps on the go. So on weekends when I used to go for FOGSI conferences, I used to be still connected to my patients through OPD and generally, and that not only taught me a lot of patience, because you have to be patient with patients so that you can connect, you can look at their messages, and then you can guide them. Not only that, as a doctor, it improvises your diction of speaking. You know exactly how to counsel. You know exactly how to tell them, because you know now that anything that you are saying or writing or prescribing is going to be captured and is going to be signed by you. So it improves our responsibility. It improves our quality of care. What Madam brought in today was connectivity. So that woman who is sitting in her own place can do her own oral glucose challenge test. She can monitor her own sugar. She doesn't have to wait in line. So depend on her husband or depend on a family or depend even on you for your schedules. So long gone are those days where in a clinic we are sitting amongst the walls. Now we are going back to the Rabindranath Tagore school. It's an open school without any walls. We have to be just connecting, talking, and what more? Sky is the limit. Today you just give them a scan code. Okay, you go here. This is where you will get MNT. Okay, you go here. This is where you can do yoga. Okay, you go there. This is what you can do. And that is something that Dr. Hema Divakar has brought in. I understand for a long time, Dr. Maninder has been trying to do this in various small little aspects. But that time, platforms were not as evolved as they were today. That time, we also did not have the security. Today, a concern comes because I have a lot of patients who come from overseas who are consulting me. And the concern comes about confidentiality. But every apps now have these filters. They maintain your confidentiality. So you don't have to be scared that whatever I'm talking to my patient, is it going to be captured by somebody? Or is the patient's confidentiality going to be challenged? Sometimes that fear is there in the minds of people when it comes to digitalization. Abhi to maine, your patient is writing me all these things. Is somebody else sitting there and stealing my data? That also can be taken care of. We at the ICOG FOGSI, under the leadership of Dr. Sanjay Gupta and with the wisdom of Madam Hema Divakar, we started the National Eclampsia Registry. And that was, first it was a mechanical one. Then we went online. Now at this point in time, I'm actually stuck. Why? Because I'm trying to get in the modern things into it. And that's taking a little while, but I'm sure things are becoming so very easy. Today, we can just write surveys, we can talk to the patient, we can connect to the patient. What will happen because of this? One, it will not only empower our patients, it will empower us also. It will also improvise transparency of treatments, and it will increase what we have been trying for a long time. Standardization of treatment, where everybody will get treatment the way it is to be given. And there will be our own guidelines, which will be quoting so very easily on the net. Thirdly, anybody, and this is something that I must tell you, Hema Madam, inspired by you, in that very long time, reaching the roots you had started. And I went in the Pune district and decided to adopt all the public health centers and the medical officers under myself. And so they used to call me on WhatsApp, Madam, placenta is got stuck. What do I do? So today you don't even have to do that. You will just like Dr. Hema Divakar's program, you said, oh, go and click here. And the patient says, okay, I'll give this medicines and that's it. So even your interface will not be there. And then what does that mean, that you are going to become redundant? No. You will always be there, but to expand only your skills, which are very essential. You will be today. The biggest need is women have so much fear of taking contraceptive pills. They have lots many questions. Can I take it? And they are then taking, the other day when I had a patient coming to my OPD, I said, just tell me, do you know which are the contraceptive methods that can be used? You know, it came the answer, the I-pill and the condoms. Now, this is a knowledge which we can spread through this digital medium, because you cannot deny the fact, as the digital medicine is evolving, so is the country and the youngsters evolving. The needs are changing. They are becoming open in their relationships. And that is a place where we will have to go and stand for them and guide them correctly, so that we will be able to holistically manage the health of this country. And as Madam said, as Maninder said, Dr. Hema Divakar always follows and is keeping up to the times. No, my dear Maninder, she's always walking ahead of times. And that is something that we have to remember, that she's walking ahead of times. And therefore, this evolution will be consolidated. If we don't do this, there are so many other pathies and there are so many other technocrats, artificial intelligence people have come a big way into medicine.
Yes.
And big way into OBGYN. Why? Because OBGYN, we made protocols, we made structured approaches. It is very easy to capture our field. Rather than going to diabetes management, heart disease management, it is so complicated and complex. So everybody is now going to bounce on us. So if you do not be there fast and before time, we will then become extinct in our practices. So therefore, Madam Hema Divakar, I thank you so much for bringing out this vision. As always, you've been so inspiring. And every time I listen to you, my brain starts, going into various synapses that nahi yaar, kuch to naya karna hai. And thank you so much for calling me, Dr. Maninder. I hope I have been able to deliver to your expectation.
Dr. Girija Wagh, thank you very much. It's not up to expectations, it's much more than that. But I'm
As
so
always.
happy that I selected the right person to give the synopsis or the Manthan. That is what I am calling it, so that people can understand what has been talked about. So that is one thing, to make it meaningful, we have to carry home messages very clear cut. So very clear cut messages are given by Dr. Hema Divakar, Dr. Girija Wagh, and Society of Meaning Life Management is always going to work with you people so that we can take these things forward. I registered it in 2018. Let's go digital. So as Dr. Hema said, yes, I have been persistent and perseverance. That is I just don't bother when I have to do something, I have to do something.
Absolutely.
So that's okay.
Yeah.
So that is I think everybody should have. Yes, I dreamt of it. And COVID-19 made it possible very early, because otherwise technology development would not have been here. And Dr. Girija Wagh, you are absolutely right on one thing. If we don't catch up now in our organization, technology will eat us. That is what I am worried about, Dr. Hema Divakar. That's why I wanted this platform, on this platform, talking about these things, so that the other people can catch up. Because one person, Hema, me, you cannot do this thing. We have to do it together only. It's the power of I which convert me to we. So that is the word gives us power. And really, in reality, I am worried that if we don't take over, the technology will take over us.
Yeah.
Because they want their profits, and there are lots of multitude profits are there in this app. Business is doing so wonderful. You don't know how much money they are already minting, and who have to give them guidelines? Me. So what is artificial intelligence? Is just basically computer learning, where you give them data. Then those data are being analyzed, and that is at a very fast speed. And they do the face recognition and they do the language. So that's all they are doing. But we are the ones who are skilled workers who are giving them these thought process. So all of us should collaborate. Dr. Hema, whatever your programs are there, I'm with you with full force, with full heart and everything, because we have to make things meaningful. I'm very shortly coming up now an international project on research. Let me do it, finish it, and then I'll get in touch with you, because again, we have to work, all of us together on that. So that India has been always blamed that we are not doing good research. Somehow or other in the world, we are not being recognized as a power even at this point because we are lacking in research. So that is the thought process which I want to start, because we had to do research that is very much required, and we have so lots of data lying. But once we start digitalization, we just start with the OPDs, our record keeping minimum. And that is what the government of India is now going to give your patients and health ID. They have already started. So once that health IDs are there, data will be there for everybody to capture. But before that, we should capture some data and make the things meaningful. Dr.
Maninder, there was one question in the Q&A. What is ABCD?
Yeah, I was going to come to that only.
back to ABCD. That's where we start. It was for anemia care, but we have added now adolescent care because start at the first available opportunity in the life course approach. That's the vision. B is building contraceptive choices, because 15 million unwanted pregnancies undergoing abortion is a clear no. We have to do something about it. And as Girija said, we have published a paper where we asked all the young people, where do they seek information about contraception? 85% of them said on the digital platform. 10% said that through their friends, and they just chat around because they're shy to tell them, also scared to tell them. Only less than 5% said. That 5% includes teachers, parents, and healthcare providers. Mix of all this is only 5%, but 85% is digital. So building contraceptive choices and empowering them to have a responsible behavior is a thing. See, cancer cervix, kill it before it kills you. Wonderful opportunity to advocate for HPV vaccine and generate the demand. So when they come to us, yes, maybe we don't have so much time to tell everything they have captured. Anyway, they go to Dr. Google, but if we give authentic information, that's good. They come take the prick and go. Or they will tell amongst the friend circle also. D is diabetes. Don't let India become the diabetic capital. That's a major mission that we are on. And if we miss the bus now, I think we'll be in serious trouble. So the E is essential and emergency obstetric care, which we are driving through Manyata initiative. That's a very basic, non-negotiable. I really think that giving birth safely should be a matter of human right, because she's not diseased. You are not even, giving her the minimal care to propagate the human race. She's taking all the risks on herself and trying to, continue the human race. But then this cannot, some minimal care anywhere she goes, public, private, gully, she must get. High risk pregnancy to sieve out and to do our best. It's a huge uphill task, because in many centers, they are not taking the blood pressure even, and they don't have time to check the hemoglobin. If non-invasive devices and all comes anywhere, everywhere, they go put their finger and they know that the hemoglobin is, it's showing red signal. That means they have to go to the doctor. Even that is fine. So A for anemia and adolescent care, B building contraceptive choices, C cancer cervix, D diabetes, and E emergency and essential obstetric care. Some 5 things we start, the low hanging fruits, which are already, of a volume that we cannot handle. We get somewhere, the first level of our grip for the next generation to be in the pink of their health. Then from there, we build the layers on top of it to give better and better and do our best. That's the best we can. And I think we are ahead of many other low middle income countries. And we have to prove it by creating our role models for rolling out like how we have done today. Yeah. So, and then all the Manyata centers will get the insights into this Indo-Israel hubs and connections and fantastic devices, few of which we are negotiating with companies to manufacture in India so that the costs will be reduced. And it's just a question of a simple 10-15 minutes training on the device for them to know how to use it. They are far ahead of us in the use of those devices in a tech-savvy manner. That I can assure you. So I think future holds a lot of excitement for sure.
See the power of digitalization. Dr. Deep Datta from London, he has sent the comments. Now, many wishes, Hema, for such an excellent talk on such pertinent topic. I found it very informative. Many thanks, Girija, Wagh and Maninder, Ahuja, for organizing and orchestrating the task.
Thank you, Deb.
So see the power we are being able to reach out now for collaborations, for the ideas
There's
everywhere.
a comment from Bangladesh also. Maninder, comment from
Yes,
Bangladesh.
they wanted to join. It's the CEFOMS group also, CEFOG group also. Everybody, we just have to send the link. We just don't have to do much of the, I think, physical work. Going to conferences, delivering talks was a ordeal. I think we still now, when we starting the conferences, we keep them hybrid so that most of the people can take advantage of that. That
You know,
is one.
Maninder, just one last thing I want to tell. Health for Her is a new, Facebook streaming advocacy channel we've started to deliberate on a topic for lay people with the experts in multiple languages. Because that's the way that the key targets, because Karnataka will not understand Bengali and vice versa. So that is another thing. And the second opinion on the consultation platform in their own language. That also, because some of the rural women, they're very hesitant to speak because they cannot. They are shy of the fact that they do not speak English. So how to connect on the digital? They have this kind of a wrong perception that doctors means then, how we will go on the digital platform and connect with any doctor who cannot understand us or whatever. So second opinion in their own language. So all this breaking the language barrier is one of the key things for the innovations on the digital platform. And many UIs are now available with the click of a button. 9 different languages will spin ahead. So even for the ASHA workers and the ANMs to ask questions, a series of questions for the decision support is coming in multiple languages. So I think this investment of the efforts towards this will have a big impact, and we are all out to do whatever it takes.
Yeah, that is where I was going to comment on Dr. Hema, that artificial intelligence itself is going to translate into different languages and transcript also. Same. Yes. So it can come as the written also, and it come as the different languages. You just have to click on the choice where you want to listen to. So the thing is, our problems will be solved to many extent where we have to go into this heterogeneous country of ours and the world also, where we have different ethnicity, different anything. And the artificial intelligence is going to make it possible and feasible and practical. The way ahead, how to go to the last mile, as you said. So reach out to everybody with the right message, but then we will be learning a lot, because this is automatically going to add data. The more we use these apps, the more data is being added, the more stronger it becomes, the more learning it will have, and the more results will be there for women's healthcare. So perhaps A, B, C, D, E. E is the last one came, but that is going to be the first one, empowering women, educating women, and really, which we have been trying to do, I think in FOGSI, I have been there now almost for 15 to 20 years. And what we were not able to reach out, we will be able to do in a very short time with the help of artificial intelligence. So we should always be ready to embrace and think about the possibilities ahead which are there. Because the way I always say, if we can't find in the research even some solution in one direction, then change your direction. Change your direction of thinking itself. I remember when I said when I was your vice president, Dr. Hema, so I said the HPV DNA as a primary modality is going to be there. And they ridiculed me because they said, no, HPV is the only way out. So within 5-10 years, at least that has been now changed. So the things are changing, and we should be ready to embrace the change. That is very important. Are there any questions? Because lots of congratulation messages are there from Kanchan, from Zinnat Nasreen, from Bangladesh. She has had a wonderful discussion by Dr. Hema. Congratulations to Dr. Maninder Ahuja taking such an initiative for this very time-demanding issue. And that Madhu Gupta is there, and everybody, they have given lots of messages. And this is streaming live on Facebook also. And we are keeping to the time. I had kept it 1 hour, but I had extended now because we need the discussions also. So maybe 8:15 or 8:30 is the time, depending upon various sessions we will be using, but this will be continuing. I wanted to do it second and fourth Tuesday, but now I thought just keep it fourth Tuesday only, because there are lots of webinars going, and so we should not create so much of rush or traffic even that the traffic jam will be there on the cloud even. So that is another solution which we'll have to find out. And Dr. Hema, please discuss about your plans later on. And with that, I think we can say thank you to Dr. Hema, Dr. Girija Wagh, Dr. Jagsonpal, who was always collaborating with me. Yeah, where is Dr. Girija Wagh's memento? Yes, Girija.
Yes, ma'am, it is there. Ma'am, it is there. Just a second, ma'am.
It is there, and it will be delivered to you.
Yes, ma'am, it will be delivered, ma'am, shortly.
Yeah, I think they should not go to
Whole morning, Jagsonpal team has been chasing me.
I must tell you, Dr. Hema, the LycoRed of Jagsonpal is a wonderful formulation, okay?
See, I am taking it. All of you should be taking it.
That it was flowing in my pen because for COVID, you know, all women with COVID, we used it very commonly to enhance immunity because of the lycopene content that it has.
Yes, ma'am.
Dr. Girija, we in Indian Menopause Society did research on lycopene. That was about time is flying like anything. I think that was 10 years back.
Some more new innovations rolling out, Maninder. It is a transdermal application of iron on the nanotechnology part, where an oil or a lotion to be applied on the skin. So it will be culturally very well accepted for the oil massage of the newborn babies, as well as, you know, we say striae cream mein mix karke, you know, it's a fortified striae cream, which will give iron, vitamin D, B12 and folic acid, and absorption because it bypasses the gastrointestinal tract. It is like many times higher than the oral. And of course, injectable, we brought it into the forefront as a quick fix method, because that's not the answer forever and forever. So in the life course approach, these new innovations which we are experimenting with, it's on a large trial on 20 lakh women and children. So we will come out with something more exciting very soon. Yes.
That way, many innovations can be there, which we thought are not going to be practical, like CTG. US had already said, which is the cost of that NST machine?
The cost is on subscription. So you don't have to pay. You don't have to pay upfront and buy the machine. The machine is lent to you, and per patient use, you have to, give it's a fee per use. So that's how the company has made it. So which is very good, because some people have a huge load in 1 month's time, hundreds of patients they'll be doing. Some will take 6 months to do that much. So they don't have to upfront pay anything, but as per their use, because it's all a recorded use, it will, reflect on how many you have used for. So you pay as per that as a subscription. Whether you finish the payment in 2 months or 20 months is not a matter. So to start with, it's with ease because there's no financial burden.
So which company is lending?
I will send you the details, Maninder. It is, it is called a FitoSense Mini. It's called, because Mini is, it's a labor room, bedside, all the staffs use it with ease. And even if many settings cannot give it to the patient to take it home as rentals, as how we trust the patient and giving in the metro cities. But when the patient comes, then any staff there, anybody can just keep it there and send you the CTG graph on the WhatsApp or through the connected device, and you can immediately opine on that and see what to do next. Yeah.
Yes. So let me see if there are any questions.
Otherwise, to buy it out, it costs about 40,000 rupees or so. But the way it's designed is that it's by subscription. Yeah.
Thank you, Maninder, for that wonderful trophy. One reason important is you captured that wonderful date of 22nd 2020.
Just remember that 22/2/22. That's very good. Yeah. So Girija Wagh is always there in observing and catching the unusual things.
Maninder, I very fondly remember Behram Anklesariya, because the CEFOM's first conference we did on 11th of November 2011. That was also 11-11-11 in Bangalore, where we did the first ever meeting of CEFOMs.
Yeah, in India. And
Yeah,
we had
in Bangalore, yeah.
CEFOMs. I was the founder member in Sri Lanka in 2010. So it has been long, and he was my mentor. I can never forget Dr. Behram and Kleseria, because they literally held on to my fingers and brought me into FOGSI and IMS.
So 11-11-11 then, and we have come a long way.
22
to 22.
22. Dr. Girija, what we wish you success in your endeavor for your elections as Vice President of FOGSI. And I think you will change the direction FOGSI once you come in. So that is what we are depending upon, the new coming generation.
With your guidance always.
Yeah.
Absolutely. All the best.
Thank you very much. I think we should say now.
All the best and all the votes.
Yeah. Let's have a picture smiling. Girija, center. Yes. So we will remain connected because it has become so easy now. So even now when we are doing this, some project is so easy now. Just connect after 8 p.m., 9 p.m., after dinner, at your convenient time. So digitalization has made our life, I think, easier, comfortable, enjoyable. We can enjoy the family, we can enjoy our practice. Like you saw it, immediately I could attend to my patients here and come back running and do my own webinar. Thank you very much for being with me, and thank you, Jagsonpal.
Ma'am, we would just like to, we would just like to present a closing talk.
Yes.
So on the behalf,
for the first time in India.
Sure.
So please.
Micronized Dydrogesterone, Divatrone. For a safer and smoother journey to motherhood, Jagsonpal Pharmaceuticals is manufacturing all the active pharmaceutical ingredients and intermediates concerning dydrogesterone, making India self-reliant. Atmanirbhar Bharat. Vocal for local. Go for Divatrone.
So a very good evening to all the respected doctors. On the behalf of Jagsonpal Pharma sales team, I, Ankit Dogra, from Medical Services Jagsonpal Pharmaceuticals Ltd, thank you for this opportunity to connect with you all today through this webinar, and are proud to present Divatrone, 10 mg tablets of micronized dydrogesterone, API of dydrogesterone, which Jagsonpal is manufacturing now. After years of R&D, Jagsonpal make all the API of dydrogesterone, making India Atmanirbhar for producing the quality API. The quality of our brand is backed by the bioequivalence study to prove its clinical safety and efficacy. Moreover, with the clinical advantages of Divatrone, it offers a safer and smoother journey to the motherhood. Our indigenous API is available with the remarkable reduction in the cost to patients, providing more economical therapy at just ₹50 per tablet. Dydrogesterone, which is in Divatrone, is readily available at all the counters near you to prescribe. Our sales team visiting you is continuously striving to make your bulk purchases experiences effortless and worthwhile. Looking forward to your support to our newest brand in our product portfolio, Divatrone. Do join us for yet another academic feast involving KOLs in the fields of ART. Please note down the webinar ID and register now. Thank you very much once again.
Dr. Hema Divakar, our next now innovation is going to be how we are going to make our own apps. That it should be there. I think professional organizations, rather than making those guidelines on the website, or we should be working towards making our apps, because that will be when we will be actually reaching out to the public. Because what we have been doing so far is just reaching out to our own medical faculty only. So now if we have to reach out to the public, we'll have to make those apps, and very soon I think that's, and it's not difficult to make them now. It's not even that costly even. The only thing is that thought process should be there. I wish some companies come in my way So we can make those
So
apps.
you mean to say like our own hospital app?
No,
as
not
in-
her. That will be our own hospital, our professional organizations like ISAR, FOGSI, IMS. They should all be making apps on their own topics which they want to disseminate. Supposing if you want to disseminate about anemia, it's not just the messages, like you said, how to do it. Then perhaps beyond that, we'll have to go a little more further so that dissemination of the knowledge can be through digital applications.
Absolutely.
Wherever needed, they will be told that you have to go and consult your consultant. But till that level, you can do it on your own. That is what I am thinking of now doing, or advising everybody, or getting the support to do, is to develop our own apps.
Right.
So that is the way to go forward. And that is the way we will be able to, like you are saying we are doing for Manyata now. Manyata is training of the, in a way, scientific trainees only. But when we have to reach out to public, we'll have to go a little different way. So many times I find when we are talking to public, the same scientific way they are talking, which they are not being able to understand. So we have to talk to public in their language. You know, yesterday my maid, her sister delivered in a very far off village of Haryana. And morning she was showing me baby's video and picture that she had delivered. So see the technology it has.
Absolutely.
My maid servant, she is connected. Sometimes when I make my videos, I tell them, you click them, stand there and click my video. So that is the way it has grown now. So it is in everybody's hand. If my maid can afford it, a rickshawala can afford it, a laborer can afford it, everybody is carrying a phone now. So I think the technology should not be far behind to reach out to them with the right messages. When like Girija said, if the technology takes over, they will take their own messages from here and there. But when we give, we will give our own right messages to them. Because otherwise they will be coming out all those ads. For iron, you should be eating this one, 10 times of ads. But when we give, we'll give the right kind of message. So that is, I want before they take over us, we should be taking help of technology to reach out what we should be doing, the right messages. Otherwise, it will be fighting just another PCPNDT Act. It will be fighting another Surrogacy Act. The way when they come up, we won't be able to fight them then. If they are
oftentimes, Maninder, oftentimes we've said that when many people say and they ridicule the patient, or they will always ask Dr. Google for the first consultation, we say that we are not out there in that space.
No.
We have to make our presence there. They have to reach out to us, and we have to make it interesting for them, and it has to have the maximum number of the pulse of the population. So many times we have seen that yes, authentic information goes out there, but as you said, if it's only a technological grab there, or if it's a half an hour slot, no, 30 seconds, 1 minute, it should be like an ad. And we need to work around it. So we will definitely reconnect. But I think everybody on this forum is quite enthused to do their bit towards this entire process. So we will draw help, connect and collaborate is indeed the philosophy.
Thank you, Hema. That was the purpose of this webinar today, and we have been successful in that. Thank you again, Dr. Hema and Dr. Girija Wagh and Jagsonpal. Good night.
Thank you so much.
Thank you,
Namaskar.